This is my exam 10 presentation or case study on blepharitis. So why is blepharitis important? It's important because it's so common. It's one of the leading causes of eye irritation and discomfort seen by ophthalmologists, and it doesn't usually cause blindness, but it can severely affect the quality of life. So people with blepharitis often experience constant itching, burning, and redness that make it uncomfortable to read or work or even wear contact lenses. So what makes it especially interesting from a microbiology standpoint is how persistent it is. So it tends to come back even after treatment because it involves multiple factors like bacterial colonization, gland dysfunction, and inflammation. It's not a simple infection, it's a chronic infection. It's a chronic interaction between the host's immune system and the microbial community of the eyelids. And that's why it's important to learn about these complex relationships between microbes and inflammation in chronic eye diseases. So blepharitis isn't a rare condition. It occurs all over the world and across all age groups. So adults tend to have it more often because as they get older, their meibomian glands, which are the oil-producing glands in the eyelids, they can become blocked or less efficient, and this leads to dryness or irritation that can trigger or worsen inflammation. And then it's also linked to chronic skin disorders like rosacea or seborrheic dermatitis, which can affect the face and scalp and share inflammatory pathways with blepharitis. So it's usually consists of red crusted eyelids, and it's been discovered a long time ago. So even though we've known about it for a long time, the condition is still a challenge to manage, which shows how complex the eye's microbiome and inflammatory balance really is. So the main goal of this case study is to explore how blepharitis develops and why it's so hard to get rid of. And that means understanding how the microorganisms are involved and how they interact with the eyelid tissue, and then also how they contribute to ongoing inflammation. And also we're going to look at the pathogenesis. This is how the bacteria attach to the eyelid margin and form biofilms, and then also trigger the body's immune system. And also we're going to explore the risk factors that make people prone to blepharitis and treatment strategies. So the main microorganism implicated in blepharitis is Staphylococcus aureus, and this is a gram-positive coccus that naturally resides on human skin and eyelids. So it belongs to the bacteria domain, and its phylum is Firmicutes, and it's a prokaryote, meaning it lacks a nucleus, and its cells are spherical, and they often cluster together in like a grape formation. So S. aureus has some special features that make it successful at colonizing the eyelid. Its cell wall contains a thick peptoglycan layer, and it provides structural strength and protects from certain immune attacks. And the capsule helps it evade the host immune system, and its surface adhesion proteins allow it to attach firmly to the eyelid margins and hair follicles. But it doesn't have flagella, so it doesn't move actively, and it doesn't form spores, which differentiates it from some of the other gram-positive bacteria. And these characteristics all contribute to its role in chronic inflammation. So now looking at S. aureus, it is a facultative anaerobe, meaning it can grow with or without oxygen. So it's also a heterotroph, and it gets its nutrients by consuming organic matter, and in this case it's skin oils or cellular debris on the eyelid. And its virulence is what makes it problematic in blepharitis. So exotoxins can damage eyelid tissue and trigger inflammation, while enzymes like coagulase and lipase help it invade the tissue and then survive on the eyelid margin. And its adhesion to molecules allow it to stick tightly to the eyelid surface, and biofilm formation is also a key factor because it protects the bacteria from the immune system and treatment. So the bacterium's genetic material is a circular double-stranded DNA, which encodes all these virulence factors and allows for potential gene transfer that can increase its adaptability. This disease that we're focusing on, blepharitis, it's a medical term for chronic inflammation of the eyelid. So the common term you might hear is just eyelid inflammation, which is simpler but it's less specific. So this condition primarily affects the ocular system, specifically the eyelids, the eyelash, and the meibomian glands, which are responsible for secreting the lipid layer of the tear film. And patients with blepharitis often present symptoms like red, swollen eyelid margins, burning, and itching. And there's usually crusting at the base of the eyelash, which also called scurf, and this is one of the most common seen features. So many people notice blurred vision or discomfort in the morning, which is caused by the eyelids sticking to the eye during sleep and tear film disruption. Other symptoms include photophobia. This is common and indicates inflammation and irritation of the ocular surface. So blepharitis doesn't have a classic incubation period like infectious diseases because it can be caused by chronic colonization by bacteria like S. aureus or other non-infectious factors. So in many cases, the disease is persistent or reoccurring over months to years, and it makes it a chronic condition rather than an acute one. And the complications can be significant if they're untreated. So dysfunction of the meibomian glands can lead to dry eye syndrome and persistent inflammation, and this can result in styes or blocked oil glands. And more severe or chronic cases may cause thickening or scarring of the eyelid margins and even loss of eyelashes. And patients may also develop secondary conjunctivitis or keratitis, which can further compromise vision. So when we think about blepharitis, it's a bit different from many infectious diseases because the main reservoir is actually the normal microbiota of the eyelids, and particularly the S. aureus for anterior blepharitis and the Corynebacterium species are also commonly found. And these bacteria usually live harmlessly on the eyelid margins, but under certain conditions, they can contribute to chronic inflammation. So the modes of transmission are direct contact, like touching or rubbing the eyelids with contaminated fingers, or through fomites, like shared towels, pillowcases, or makeup applicators. And unlike diseases with a clear exit pathway, the portal of exit here is kind of complex because bacteria largely remain on the eyelid, making this disease very localized and a chronic infection rather than a highly contagious systemic one. And then the portal of entry is the same area, so eyelid margins, eyelashes, the meibomian glands, openings where bacteria interact with host tissues and cause inflammation. Blepharitis can affect any age group, but it's more frequently observed in adults, and especially those with underlying systemic conditions like rosacea or seborrheic dermatitis, which can exacerbate eyelid inflammation. And children can also develop blepharitis, but it's less common. And regarding prevalence, blepharitis is considered a common chronic eye condition, which is frequently encountered in ophthalmology clinics, and the disease can be persistent or recurrent, which makes it clinically significant despite not being life-threatening. And recent trends of this infection show increased incidence of medication-induced blepharitis, particularly in patients undergoing chemotherapy or monoclonal antibody therapy or treatment with immune modulating drugs like TNF-alpha inhibitors or dupilumab. And these cases basically just highlight the importance of blepharitis and that it's not just a primary ocular condition, but also a potential side effect of systemic therapies. So now I'm going to talk about the pathogenesis. So the first step in blepharitis pathogenesis is entry. The bacteria are already present as part of the normal eyelid microbiota, but they can gain eyelid they can gain access to the eyelid margins, eyelashes, and meibomian gland orifices where they establish themselves more densely. So when they're able to establish more densely is really where the infection occurs. So in anterior blepharitis, there's two different types. Anterior blepharitis, the SA auris adheres to the skin and hair follicles, which triggers localized inflammation. And for posterior blepharitis, the process is similar but slightly different. So in this, the meibomian glands are dysfunctional, and this affects the lipid layer of the tear film. And then this dysfunction allows for bacterial growth, overgrowth, and it also contributes to inflammation of the eyelid margins. But both posterior and anterior types involve direct bacterial colonization, and the triggers and affected structures differ. So once the bacteria are established, the eye's immune environment plays a big role. So the eye is considered an immune privileged site, meaning it naturally limits inflammation to prevent vision impairment. So inflammation is less robust than anywhere else in the body, allowing bacteria to persist. So despite this, the immune systems will still respond, and bacterial toxins and mechanical irritation and immune reaction against SA auris will trigger chronic inflammation. And then over time, this repeated immune activation of blepharitis, such as redness, burning, and irritation, will occur. And then the immune evasion by bacteria combined with limited ocular immunity explains why blepharitis tends to be long-lasting and sometimes recurrent. So finally, the damage phase involves the clinical signs of blepharitis, which is chronic inflammation. This can produce the scurf or crusting, and then it can also form like a greasy skin along the eyelids, and there can also be changes in the eyelashes, like trichiasis, or eyelashes will even fall out. And the repeated tissue stress can contribute to other complications like dry eyes, conjunctivitis, or keratitis and styes, and even corneal damage if it goes untreated. So unlike many infectious diseases, blepharitis bacteria generally stays localized on the eyelid margins, and there's no major portal of exit, which sets it apart from other bacterial infections. And this means it's not highly contagious, but it can persist in the patient and cause recurring inflammation. And the combination of the chronic tissue damage and local immune responses and bacterial persistence explains why managing blepharitis requires ongoing care. And then here are my sources.